Good morning. So I realized I did the thing that every speaker should do, which is make sure there was like a clicker up here, and I did not do that. So I'm sure someone's going to bring me one momentarily. Oh, Daniel has it. Thank you. So welcome, everyone, to the 2018 Symposium. We are going to start out this morning by singing happy birthday to the 38th state of the United States, which is who do you think? Colorado. We are 142 years old today. So, whoops. Happy birthday to you. Happy birthday to you. Happy birthday, Colorado. Happy birthday to you. And so with that, I also want to take the moment to acknowledge all the public servants who serve the state of us and the state of Colorado. So if we could have all of our elected officials, anyone who's an employee of a federal, state, local, city, municipality, please stand up so we can acknowledge you. Thank you. So, I always like to start this symposium by trying to give you the running start of where we've come since the last symposium, since we saw you this time last year. So last year's symposium, the 2017 symposium, we focused on the impact of inequity on health, and we had a lens particularly of the racial impact. I could never have imagined, nor could you have told me in advance that I would have believed you, how controversial that symposium was. I wouldn't say it was polarizing, but I would say we had people on polar ends of the spectrum as it regards to whether they thought that was good or bad. And after the symposium, I published a blog that kind of synthesized both sides of that feedback. And it is certainly feedback we take seriously. However, it is still a commitment we have. We still have our commitment to be in service to an equity agenda and in service to low-income Coloradans and those communities who have traditionally lacked power and privilege. And in many ways, those are, again, our poor residents and communities of color. So that conversation is going to continue even today. It was a building block to everything else that we do. In the meantime, in the last 12 months, we shared with you our refined focus areas. So the foundation has a focus on nurturing maintaining healthy bodies, in which we're talking about access to care and children moving more. Those are the two things we decided to focus on there. I'll come back later and talk about nurturing healthy minds, because that's the focus of this. Then we have strengthened community health, and our focus there are on those environmental and social conditions outside of the traditional view of health. So we've decided our resources we hope can make a difference in the areas of access, food security and access, and in affordable housing. In addition, this is where our focus on community solutions resides. The foundation has an agenda, but we also realize that the rhythm of communities doesn't necessarily beat to the drum of the foundation's agenda and the foundation's schedule. And so with that, we want to be able to listen to community will that has come up from the community that may or may not be part of our agenda, and we want to be able to use the resources we have to bring to bear to support and respond to that. And you'll see in the coming months some funding opportunities around that. And then finally, in championing health equity, that's where our work for advocacy and capacity building resides. Because we want all of the folks that we work with to be fully equipped, not just institutionally, but also communities and bodies of, and people to feel that they're equipped to bring the voice of the public to the policy arena. And so that whenever policies and rules or laws are made, whether they're at the local level or at the state level, that they truly reflect the will of the people and not the will of a few. And so that is our agenda. Undergirding all of that are what we've come to call our cornerstones. And those cornerstones are regardless of what our focus areas may be. We could change the focus areas tomorrow, but we're not. But regardless of what we choose to focus on, there are three things that are non-negotiable for us. One, and the non-negotiable is for us and for all the people who we partner with, all the people who we support, is that there has to be a commitment to serving low-income Coloradans and Coloradans whom historically have not had power and privilege. The second is a commitment to an equity agenda and closing that gap. We talk about bringing health in reach. We want to bring health in reach for all Coloradans. And for many, not only is it not even in reach, it's not even within sight. So we want to be able to bring health in sight and within reach of all Coloradans. And then finally, we want us to be and we want you to be informed by the community and informed by those that you exist to serve. And the community takes all kinds of forms. Sometimes the community is a community of providers. We want to know what you're struggling with. Sometimes the community is the legislative community. Sometimes the community is the community outside the traditional health field. And sometimes, and very often, and constantly, the community has to be the people who are experiencing the issues that we hope to work with them to have some impact. So those are all things we shared over the year, but it's important for us to reemphasize that these are core. These three things, as far as we are go at the foundation, are part of the air we breathe. It's part and parcel of just our DNA. It's our institutional and our mission DNA. And along with that, there still is our commitment to, in listening to the community, we have to be in and among and with the community. And so our staff and I have a commitment, and we are constantly in community to learn from community, learn with community, and learn about the community. And this is my favorite part of my job, which is being out in community in some places that I never heard of and probably couldn't find right now without my GPS if I didn't know. But there are just magnificent people all over this state, across all ethnic lines, across all socioeconomic lines. And there are people who care deeply about the health of their community and how to make it better and how to feel empowered to have permission to do that. So we still have that commitment. And then, even though there was some polarization on the last year's symposium, we take the feedback seriously. And even during the symposium last year, we acknowledged that a perspective that we had not given enough time to, was the perspective of the inequity of white poverty and its impact in the state. So we held what we called a symposium unplugged, and because certainly white poverty in Colorado is not limited, is not solely in rural communities, but it is heavily in rural communities. So that was held in Yuma. If Yuma had had a space that could have held this many people would have come. But we had about 300 people in Yuma for the day, and it was a great discussion. We are thinking about, I'm going to get a really ugly look. We're thinking about maybe recreating that one again in another part of the state. And there will be, in November, we know there'll be another symposium unplugged around behavioral health. I can't tell you what that is yet because it depends on the feedback out of here. Once we hear from you about what you would like to have heard more about, gone deeper on, or something that we just ignored in this symposium, that will become the content for the Symposium Unplugged we're going to do in November. Now, back to our behavioral health priorities. In the foundation going deep into this area, and this, I would credit listening to the community as the reason we have gone so deeply into this area. Because it's the issue that came up in every county in this state. And it is top of mind, it is prevalent, it is prominent, it is pervasive in all its forms. And we wanted to, where could we bring the resources we have to impact this? So we've chosen 3 areas. One, in early childhood social emotional development. We want every child to have a healthy, productive, loving relationship with at least one adult. So we want to work with the caregivers. We're figuring out how we're going to work with caregivers to help cocoon our youngest so that they have that relationship, so that they hopefully don't experience so many traumatic events. They don't experience abandonment and all the kinds of things that happen that you all know how that manifests itself later in their life. And then with teen and young adults, that 12 to 22 age, we want to help build emotional resiliency, emotional and psychological resiliency, so that those young people can bend and adjust and withstand the pressures that they experience in their lives, so that something like hurting themselves or hurting others never enters their mind as one of the options that they could consider to make things better. And then with adult recovery, we want any adult who is experiencing, is in recovery from substance use disorder or any other mental illness or mental disorder, to be able to find recovery support near where they live, in their community. So that's what the foundation is focused on. The symposium will cover those things and others. We're not limiting the symposium to those 3 things, but want you to have a better understanding of where we as a foundation are wanting to put our cash and our cachet. This year's symposium, it is larger. We've added 100 spots, and over the last 2 years, it's a total of 250 larger than it was in 2014. It is more diverse in organizations, in geography, in perspective, in the gender identity spectrum, socioeconomically. We have broadened that audience. Now, last year I threatened to have a lottery for attendance. Didn't go to the lottery. We did add some spaces, but we did add some organizational limits so that we could make space for more diverse people. Now, some of you have been amusingly creative, and some of you just downright sneaky on trying to get around that limitation. You know who you are, and we know who you are too. And this time, for the first time, we did a call for the afternoon sessions. Typically, we would just curate ourselves those sessions. But because we wanted to get broad perspective, diversity, hear directly from the community, we did a call for proposals. I think we had about 50 proposals, of which we were only able to choose 8. But we hope you will enjoy what those 8 will be this afternoon. And then we continue to broaden the range of people who we want to feel that they have ownership in the issues of health and equity around the state. So last year, we invited we had law enforcement represented, because that's a perspective that's a perspective on the health of a community that has ownership in that, and we want them to feel ownership. This year, we've made an outreach to the faith community. And we've got, I think, 12 to 15 members of the clergy here. Next year, I hope we can get that number up to 50. But that's a group that exists in every community, that are typically well-respected and seen as influencers amongst the communities that we're talking about. So that's just another example of trying to broaden the people outside of the normal who's in healthcare who have a role in the state and community addressing these issues. We've got some features this year. Last year we started the Virgilio Lacona Award, or was this the third year or the second year? This is the second year. This is the third year. We typically do that on Thursday evening during the reception. We're going to do that today before lunch, so that it is such an important award. It is such an important way to honor Dr. Lacona's legacy that we don't want you distracted by conversation and whether you're inside or outside. So we're going to move that to right before lunch today. Outside also, there's a podcast audio booth where we're asking you to go in and be willing to kind of share the impact of behavioral health issues or mental health issues on you, or its impact on your life because of someone else that you know. What we hope to make out of that are 2 20 to 30-minute podcasts that will come out of that over time. So I ask you for those of you who feel comfortable, to go and share. Our exchange sessions this afternoon, like I said, are generated from the community. There's some that are on, there's a law enforcement piece, there's some about schools, there's some about how communities our native communities are working together to combat these issues, so I hope you will enjoy those. We've got a film screening tomorrow night. There's a is it called Help? Scream? Escape. I was close. I knew it was one word. It's called Escape, and it is about the plight of the Ute tribe adolescents and the mental health. And so we hope you will come to that, enjoy the reception, and hopefully enjoy the dance party after also. Then on Friday, we will start the morning with a listening lab in a way that we're going to give 60 to 80 of you an opportunity in a guided way to actually help us all think about what are the issues that are prominent in the state, what are some solutions that you know of that are working, whether they're here in Colorado or not, and then give you an opportunity to advise the foundation on how we could and should move forward and be helpful in those ways. And then you can leave if you want to. You know, some of you leave early on Friday or Thursday night. You can leave if you want to. But the people who stay till the very end on Friday, well, we will be making donations to 2 or 3, I forget. We'll be making 2 or 3 $10,000 donations to your organization or a human service organization in Colorado of your choice. But you must be present to win. So I'll just put that out there for you. And again, what to expect. Today we want to dive into kind of the history and the current status of behavioral health in Colorado and the nation, and how those policies and practices over time have either unintentionally or intentionally disproportionately negatively impacted low-income and marginalized communities. Tomorrow we're going to hear some personal stories, and one of the highlights being Sue Klebold, who will be here, Dylan Klebold's mother, and coming from the perspective of a parent and answering the question everybody wants to hear from her, which is, how could you not have known? And then we've got a father and son who will be talking about their perspectives on the same issue of how mental health and behavioral health issues impacted their lives. And then Friday, we're going to move to solutions. Tonight, I particularly want to encourage you to be on time at 6. We will actually start in here at 6, where we'll be hearing from our 2 lieutenant gubernatorial candidates, Dan Primavera and Lang Cias, about their platform on health in general and behavioral health. So please come to hear that, and then we'll have our reception. And then finally, as I try to remind you every year, enjoy yourselves, participate, learn. Don't just talk to the people you know. You're going to see them again anyway. Meet at least 50 new people. Make 50 new friends. And of course, tweet. Or Facebook. Or send emails to your listserv. So I'm looking forward, I hope, as you are, I hope you're looking forward to an exciting symposium. I'm going to turn it over to Amy Latham, our Vice President of Philanthropy, to get the rest of the morning going. Thank you.